Hi dear friends, hi all. This is Dr. Nazima Sharif. I am a practicing dermatologist at Radiant Skin Clinic from Bangalore. Now if you are all watching this to know more about acne scars and its treatment, you are on to the right video. Acne is a worldwide condition. It is said that a person can get acne at any time in their life, and acne is one of the commonest disorders you can expect anybody to have at least once through their lifetime. Though it is common, it is affecting both males and females. It can affect any age group. This condition and its scarring at the end of the acne lesions can cause significant psychological distress, career prospect interference, marriage proposal interference even now. So when we are talking about acne scars, I would like to first tell you a little bit about acne and why I think acne should be treated first before we address the scars. One cannot go and expect a scar treatment to improve when you have an active acne going on. So you need to visit your dermatologist who will help you control that acne first. If while you have active acne, procedures are started, they are going to be multiple procedures and they can have adverse effects if there is an acne scar with bacteria in it. So please address the acne first before you address the acne scar. Moreover, there is no point in treating acne scars while every new acne is leaving behind a new scar. So you are literally going around in circles. So this is one of the most important points I wanted to stress to you all, because most of you are concerned more about the acne scars or the marks that it leaves behind rather than the culprit, which is the acne. So this is the first aim of treating your acne scar. Our first aim is control the acne. So now let's address the main reason why this video is on for you. That's the treatment for acne scars. I will give you just a brief idea what your dermatologist will do for you, so you can be prepared a little bit before meeting up with them. We do treat acne scars with topical applications in the form of lotions, creams, gels. We also give certain procedures which I will discuss about with you later. But the most important topical applications that I would stress on first and foremost is a good moisturizer and the right sunscreen. I need you to also avoid using a heavy makeup, going in for facials, because these can aggravate acne in between your procedures. Please also address the fact that if you are on to any other medications, inform your dermatologist so it doesn't interfere with your treatment. To start with, we use AHA gels, lotions like glycolic, for home use anywhere from 3% to 10%. We can also use beta hydroxy acids like salicylic acid, which are available, topical vitamin C preparations. Now when it comes to an actual scar treatment which involves procedures, that depends on what type of acne scar you have. Most of the people have a variety of scars on the face at one point of time. There are three major types of scars. One is called an ice pick scar, which is a sharp V-shaped scar going deep into the skin. The second type is a box type of scar, which literally is like a box where the edges are sharp. The last type is the rolling and the most friendly scar for all of us, and that scar has edges which roll gently into the base of the scar. It is the rolling scars which give us a good result. Then comes your ice pick scars and box scars. So treating box scars and ice pick scars are a little more difficult. So even though you may carry out many procedures, you may find improvement with some scars and not significant improvement with the other. So it doesn't mean your treatment is or your procedure is a failure. The commonest procedure we would like to start with are chemical peels. Most of them are alpha hydroxy acids, beta hydroxy acids, retinol peels. These peels and their percentages will be decided by your dermatologist, and these can be started while you are on treatment for acne. Then there are certain other procedures where we wait for the acne to subside. For example, microneedling or roller. I am sure many of you have heard about that. What does this do? This is a machine operated procedure where minute, multiple, tiny, deliberate trauma and the points are inflicted onto your scars, which stimulate a good collagen formation, which lifts up your scars and tightens your scars. These are to be done at an interval of 3 to 6 weeks for a few sittings. When we combine the rollers, we may combine it with what is called PRP, that is platelet rich plasma, which again it will be more in depth discussed with your dermatologist, but basically involves removing your blood and extracting the platelet rich plasma and applying it onto the skin or injecting it into the skin while the microneedling session is going on. Sometimes we combine the microneedling session with another machine or another technology called radiofrequency, and that's called microneedling radiofrequency or MNRF. So that comes as one machine which addresses again causing minute trauma points and also a heat generated technology which helps to strengthen your collagen and promotes new collagen formation. There are other types of similar trauma causing therapies, for example, laser resurfacing. Here, instead of using a physical modality, we are using light energy, but to have the same physiology behind it to cause minute trauma, deliberate and a controlled trauma to give rise to good collagen. There are also instances where when acne scar is not improving at all, especially a box type of scar, here we can sometimes do a small punch removal of that scar and suture it. In ice pick scars, sometimes we have special peels that we put into an ice pick scar to cause damage to the walls of the ice pick scar so that that inflammation can close your ice pick scar. There is also a special procedure which your doctor might discuss with you if needed, called subcision. Subcision is basically a scar release procedure where a special needle is inserted under the scars to break off the scar fibers which are holding your acne scar below the surface. So sometimes we do a subcision and then follow it up with microneedling, laser, PRP, TCA peel for ice pick scars and so on. Sometimes we also give what are called collagen injections after doing a subcision under each scar to help lift up the scar. So at the end of it, dear friends, I would like to tell you one thing, that I hope I have been able to give you some overview, some information about what type of acne scar reduction therapies are available. As a doctor, my advice to all of you is for any of your skin, hair and nail related conditions, please do not self-medicate. Please do not do the procedures by yourself. Please consult a qualified dermatologist to help you get the best and desired results. Thank you. I hope I have been able to give you an overall review on acne scar procedures and that you will find it helpful, especially when you download informative videos from DermaVidya. I also encourage all my friends, please visit your doctor, your dermatologist to have your treatment customized, and please do not self-medicate and please do not do any such procedures by yourself at home. Thank you. So to conclude, dear friends, dear all, I hope I have given you an overall idea about acne scar treatment, and I would encourage you to log on to dermavidya.com for further such videos. And I also please advise you, do not self-medicate, do not do the procedures by yourself. Please meet a qualified dermatologist to get their help for your condition, customized treatment and good outcome.
For more such videos, visit or log into dermavidya.com.